Let's set the stage. Why has a 34-letter enzyme you memorized in biochemistry suddenly become dinner table conversation for your patients? 1. The data spike. First, the data. Watch this. Google searches for MTHFR were flat for years. Then around 2020, interest doubled and it spiked again after a certain podcast appearance in 2022. Spoiler, that was Joe Rogan's interview with wellness personality Gary Brecka. 2. The viral soundbite. Here's the 15-second clip more than 5 million people have forwarded to their friends.
MTHFR. This gene impairs the ability for the human body to convert folic acid and some of its derivatives into the usable form called methylfolate. Its ability to impair.
Whether you love or loathe influencer medicine, that reel planted a memorable hook and your patients heard it. 3. 4 patient personas you'll meet. To make it practical, meet the 4 personas who now walk into exam rooms talking about MTHFR. 1. DIY biohacker Dan already owns a $199 DNA test raw data file. Wants methylated everything. 2. Anxious mom-to-be. Maya, 2 miscarriages, saw TikTok stating MTHFR causes them, fears next pregnancy. 3. Exhausted Ellen, chronic fatigue, brain fog forms say MTHFR is the root. 4. Refractory depression Dave, 3rd antidepressant trial failing. Reddit thread says L-methylfolate and MTHFR testing are game changers. Different stories, same punchline question. Doc, can you test my MTHFR? 4. 3 amplifiers of patient demand. 1. Direct to consumer, DTC genetic kits. 23andMe, Ancestry, and smaller biohack labs now deliver SNP readouts straight to inboxes, often without clinical context. 2. Algorithm-powered social media. Short-form video pushes sensational health claims. The more dramatic the headline, folic acid poisoning half of America, the more shares. 3. Supplement marketing. Once a fear is seeded, algorithms serve ads for $60 bottles of methyl Bs or $600 custom gene panels, creating a closed loop of confirmation. 5. The resulting clinician pain points. So what lands on your desk? Information gap. Patient knows their genotype. You haven't ordered the test and now must interpret it. Expectation gap. Patient believes gene explains every symptom. You know multifactorial reality. Time gap. Explaining all this in a 15-minute slot. Today's session will give you the quick scripts and evidence you need to close those gaps without dismissing legitimate concerns. 6. Transition to biochemistry. All right, hype decoded. Now let's arm you with the actual science behind MTHFR so you can explain it in plain English. Grab your coffee, click ahead, and I'll meet you in segment 2.